the evidence on hormone replacement therapy, as I did last week in women in menopause and this week in men, and also in women with respect to testosterone replacement therapy. We're going to bust down the barriers. We're going to unveil the myths that are out there, the background, the history, like what the heck is going on? Well, analogously, as I shared last week with the WHI in 2002, they got everybody so scared of women's hormone replacement, estrogen, progesterone, to be specific, because of this WHI study, the Women's Health Initiative, that was erroneously interpreted to basically tell people, all of those out in the world, but by literally the media was just going nuts with this, telling them that hormone replacement therapy caused cancer, breast cancer specifically, and this just was not true. In fact, as I shared last week, the estrogen group that was getting the hormone replacement actually had less incidence of breast cancer. So this crazy, crazy mistruth, this fallacy, this whole idea that estrogen causes breast cancer is bogus. It's BS. It is not evidence-based. In fact, this study even showed that those getting estrogen alone actually had less breast cancer. And this was not the study group that you would imagine would be ideal, right, for hormone replacement therapy, as these women averaged over the age of 60. It was about 63 years old on average. And so they were giving, for the first time, many of these ladies hormone replacement in the form of estrogen and progesterone, which were synthetic, not bioidentical like I would recommend, but getting synthetic hormones at an age beyond menopause when they're not really getting the optimal benefit, which is, of course, number one, numero uno, so that they live a better life, so they have less of these adverse effects, conditions, symptoms of menopause, like the hot flashes, the low energy, the brain fog. Like, holy crap, did you know that in the brain, the estrogen actually, the drop, significant drop, actually changes the metabolism of glucose in the brain? So there was a physiologic reason for why these women are having brain fog and trouble concentrating, focusing, remembering things, all the things. This is not them. This is physiology. And estrogen replacement, specifically hormone replacement therapy, can be a game changer for them, as today we're going to talk about in men and also in women, the benefits and the background and the physiology, what's happening with testosterone replacement therapy. So firstly, I just want to go out and give you a little bit of a backstory. Back in 1990 in the US, they placed the testosterone hormone, which is a biologically naturally occurring hormone in both women and men. Yes, I said it, in women. In fact, many don't know this, but in women, if you actually took the raw, real number of how much testosterone is floating around in the blood and compared that to how much estrogen, progesterone, prolactin, etc., testosterone actually has more of it floating around in the female circulation by the volume, if you will, than both estrogen and progesterone and the female hormones. Like, it's crazy, yet we almost never talk about it. So it is important. Yes, go back and re-listen to that podcast I did on testosterone. It's important in men, and it's also important in women. But what happened in 1990 was that the US decided, sort of governmentally, or as one would say, gubernatorially, that testosterone should be on a Schedule III prescription basis, which is basically a controlled substance. So that immediately brought out all these barriers, all this stigma. Like, providers were like, oh my gosh, this is a scheduled medication. You actually have to prescribe it using your DEA license, the Drug Enforcement Agency license, and there's got to be triplicates, and it's a lot of red tape to this to be able to prescribe this bioidentical hormone in men and women. Like, holy crap, there was this fear, like they were doing something wrong, like maybe it was going to harm somebody. And I'm going to share with you this whole backstory, what's going on, the new data, which basically shows that it is safe. It's not going to cause more heart attacks, for example. It's not going to cause more adverse events. And yet it could be a game changer for men and also potentially for women. But back in 1990, they decided it was going to be a scheduled medication or a controlled substance. So that's kind of where the root of the fear really started to really be created. And the decrease in prescriptions have been shown to correlate with this. In present day, it is very low. Less than 10% of supposed, men are getting the testosterone replacement that they could benefit from because of the fear, the stigma on both their part and also on the physician or provider part that's concerned because it's a controlled substance. And a lot of that came from this initial regulation, placing it on the controlled substance list, but also some erroneous data that was suggesting that it was dangerous. It was dangerous to prescribe testosterone because you might give somebody a heart attack and you might cause prostate cancer. None of this is actually true. In fact, finally, in around 2014, 2015, the FDA was like, okay, we'll look at some newer data. And they looked at what's called the Traverse trial. That was done in 2023, which basically showed that it was not any more likely to get a heart attack from getting testosterone as it was from a placebo. And so basically, finally, they came and said, okay, this cardiovascular adverse effect thing that we were sharing about is actually not true. This is actually published in one of the biggest medical journals in the world called the New England Journal of Medicine, which is like legit one of the biggest medical journals in same, type as journals like Nature, JAMA, things like that. Like this is legit one of the top medical journals. And in 2023, July 13th, it published this study called Cardiovascular Safety of Testosterone Replacement Therapy. And they shared in a study, and this was a double-blind, randomized, placebo-controlled trial, which is basically first-degree top evidence, the best quality of evidence you can have. And sadly, many of our guidelines are not based on this quality of evidence, right? They're based on what we would call observational data. There's things like surveys that have been collected, like almost all the data in the nutrition world is based on surveys and what we call observational data, not randomized controlled trial. Well, this is level one evidence, the best evidence available, reported in one of the best medical journals out there, the New England Journal 2023, stating cardiovascular safety of testosterone replacement therapy. And so they studied 5,246 men, ages 45 upwards, up to I think about 80. And they basically showed that using testosterone replacement therapy did not cause more heart attacks than in the control group. And actually, the control group, the group that was not getting testosterone, actually had more heart attacks, believe it or not. So it wasn't statistically significant. There was something like, let me get the data here, endpoint of cardiovascular adverse events in 190 patients in the placebo group and 182 patients in the testosterone group. So actually there were more adverse effects cardiac-wise in the control group, those who did not receive testosterone, than in the testosterone group. But basically it was approximately the same. Didn't make any significant difference. And so they said in patients getting testosterone replacement therapy, there was basically no difference with respect to incidence of major cardiac adverse effects. That's it. Boom. Mic drop. Done. Stop saying testosterone causes heart attacks. It's just the data is not there. This is basically the best data you could get. Level one evidence, randomized, double-blind, placebo-controlled trial, New England Journal, best journal 2023, stating it is safe from a cardiovascular perspective. So let's move on from that. We can't be, propagating this myth in the same way that last week, the propagation of the myth that estrogen causes breast cancer is just total bogus. The data does not show that. And in fact, even in that WHI initiative study, it showed estrogen therapy actually decreased the risk of breast cancer. So anyway, enough of that. But sadly, because of that initial angst, concern, fear that started way back in the 1990s, both with the scheduled medication thing and some earlier thoughts that it might cause more cardiovascular disease, simply is not true. In fact, there are so many things that testosterone can do, can benefit. In the obvious, right? Everybody knows that it increases sexual function, desire. There's been many trials that have shown this. There's a New England Journal trial as well that shows this, and many others that suggest not only that the evidence is there, that testosterone does improve sexual function and desire in men and women. Actually, in fact, that's the actual indication to be able to prescribe it in women, is exactly that, is exactly for the sexual performance, desire, and what they call the HSDD indication, which is basically based upon desire. And that's the indication. It is often used, of course, off label for a lot of other things like increased energy, increased bone health. In other words, bone mineral density goes up with testosterone use, more likelihood to increase and maintain muscle mass. So women and men can actually age powerfully, like JJ Virgin loves to say, age powerfully because of adequate testosterone and getting a level which is appropriate. But basically, the pros of this in both men and women is significantly, in my humble opinion, outweighing any potential downsides. There's actually very few downsides, even in the case of men who have had history of prostate cancer. In the same vein as those women who have had history of breast cancer that are not currently having active cancer, you can give hormone replacement. You absolutely can, and you can do so safely. Same thing with men. The data is there to support that it is safe. You just don't want to be giving it during an active cancer flare, right? That kind of makes sense both with women and men. You don't want to give the hormone replacement during a cancer flare when the cancer is active, but when the cancer is no longer active or cured or what have you, these therapies are safe in women and men. In fact, uh, for women, I just mentioned this, the consensus for giving it for women to help improve their sexual desire and function is actually been now shared across the globe. This is the Journal of Clinical Endocrinology and Metabolism. This was a paper that came out a couple of years ago, 2019, October, issue number 10, and it was entitled The Global Consensus Position Statement for the Use of Testosterone Therapy for Women. And they basically talked about this exactly, that it is indicated in women with the low desire, the so-called female sexual dysfunction, as well as having low androgen levels when compared to what the optimal levels should be. And the same thing goes with men, right? You want to have not just marginal levels, you want to have optimal levels. And that's kind of where I think a little bit of the debate happens present day. In men, they sort of give this arbitrary number of around 300, and anything lower than that is what they would call hypogonadism. I believe that the symptoms can outweigh the raw number, because you have to look at not only the total testosterone, that's what this 300 level refers to in a man. If you're lower than that, it's pretty much slam dunk. You have what's called hypogonadism, which is a low testosterone state, which would imply that you need that, yes, therapy, TRT, testosterone replacement therapy, is indicated to replace that. But I would say even if your number is a little higher than 300, my personal number a couple of years ago was like barely above 300, and I did everything. I did the diet stuff, cleanest diet, the best sleep, having 7 to 8 hours in the cot every night, quality sleep, getting to bed early to try to get my own rises in both growth hormone and testosterone overnight, as well as doing the work, increasing my muscle mass, resistance training, eating the appropriate diet, adding some supplements that specifically targeted an increase in testosterone. And guess what I did? I got it up a few points. I think it went up from like 300 to like 350. And that was with over a year's worth of effort, doing all the things, both with the exercise, both with the weight training or resistance training, as we like to call it, improved diet, improved sleep, improved stress optimization. And yes, I got my level up a little bit, but I could not get it back to the level of performance, the level that you would want to have so you feel great again, feel the same energy, the same strength, the same vitality that you would as, say, a 20 or 30-year-old. And so I personally um, do take testosterone replacement therapy. And I'm just going to say that I'm not ashamed of it, because I believe that can improve not only your physiology, your quality of life. So you not only add, as I like to say, years to your life, but truly add life to your years. And so personally, for all the indications that are out there, having both a low number, and that's measured on multiple times. I've had my level measured every 3 to 6 months for the last several years. And in addition to that, you can't just get a total number, because that doesn't tell the whole story. You have to also do what's called a sex hormone binding globulin, as well as a free testosterone number. And this is in women and men. Very, very important. Sadly, most doctors are not checking these things. But anyway, it needs to be checked. You got to have a look under the hood. You can't guess this kind of stuff, because I was flabbergasted. I felt pretty good, not great. I was a little tired, more tired than I would have hoped. I wasn't putting on muscle in the same fashion that I would like to. I knew that probably my number was low, but I didn't guess that it would be as low as 300. I thought maybe mine was 400 or 500. Optimally, I'd love to see it 800 or 900 range. It was not. It was literally in the 300 range, but I would have never known had I not checked under the hood. You simply have to check because not only can it improve both in men and women, your sexual function, desire, energy levels, etc. Also, if you have anemia, for example, that's a low blood count, it tends to improve that, can actually improve your blood counts. And this is definitely something in men you want to be monitoring because you don't want to have them what we call thrombocythemic, which is have too much red blood cells. You don't want to get that number too high. So you got to monitor that, I would say, at least every 3 to 6 months because it has been known to increase hemoglobin, which is usually a good thing unless it gets too high. In women, it's usually also a good thing because a lot of ladies out there do suffer from anemia or a low red blood cell count, for example. Another positive pro for testosterone, as I shared earlier, is its increase in bone mineral density because it's been shown to improve the strength of your bones, kind of like how I talked about estrogen last week. It actually encourages the bone to form, which is the osteoblast cell formation, putting down new bone and kind of diminishes the breaking down bone cycle, the osteoclast, which is demineralizing or breaking down the bone, and improves the overall physiology of your bone, your structure, your strength, both in women and men. It's been shown to do that, and also to increase your lean muscle mass so you can actually put on more muscle because that is the key to not only feeling amazing, but it's the key to your metabolism, as I've shared on many episodes. Literally, slam dunk, hugely positive with respect to the increase in bone mineral density as well as in muscle, lean muscle mass increasing as well. And this has been shown both with respect to increasing your bone mineral density. There was a study in the New England Journal as well. That same awesome journal, this was January of 2024, titled Testosterone Treatment and Fractures in Men with Hypogonadism. Once again, not only is testosterone safe, but it was helpful. And also, it provides not only the signal to increase the bone formation, but also helps you with your workouts, with your resistance training. It's not going to just make you have muscle. It's not like a steroid, like the steroids that these weightlifters and stuff are taking. It's not like that at all. And so that's kind of this weird, not supported by the evidence fear that many people have. Oh, I take testosterone, it's going to make me look like Arnie. That's not going to happen. In fact, it'll help you to put on a little bit of muscle mass as you work for it. You have to do the training. You have to do the work. It's not going to just make you grow muscle with doing nothing. It's not like that. You got to do the work. You got to do the resistance training, which is super important in men and women so that you can have strong bones, strong muscles, have that vitality to get you feeling great and for the duration. So the other thing I wanted to share briefly, as at the opening I shared with respect to cardiovascular effects, there's basically no good data that shows you'll have more likelihood to have a heart attack, whether it be men or women on testosterone replacement. The data is just not there. In fact, that big trial I shared about over 5,000 patients recently, I believe that was 2019, the Traverse trial, showed that it was no different in causing cardiac effects as just a simple placebo. In fact, the placebo, as I shared, caused more adverse cardiac effects, but statistically they were similar. There was no real difference there. And so to have that fear of, oh my gosh, I'm going to have a heart attack because I take testosterone, unwarranted, there's no data to show that. And now the FDA is recognizing that, which is great because from 1990 onward for over 20 years, almost 30 years, there was this fear and it just was not supported by the evidence. So hopefully that will put an end and sort of the proverbial nail in the coffin as has the recent data and relooking at the WHI for women and getting the hormone replacement therapy that they may so desperately need to ameliorate symptoms, but also provide them with the best possible cardiac situation. As I shared last week, the estrogen actually decreases cardiac adverse effects, improves your cardiovascular status, and many other things. And so here's a case of a gentleman that I worked with in his 50s, wasn't having all the energy that he wanted. His hemoglobin was a little on the low side, especially for a dude, very sort of bottom of normal range, 12.3. He had a couple of levels that we drew over the course of about a 3-month period just to make sure that they were accurate. Morning levels are the best, for example. And despite him already working on diet, exercise, all the things, his level was a little below 300. Also, his hemoglobin was 12.3, as I shared, which, like for a dude especially, is kind of low. And so we addressed sleep issues, we addressed training issues, we addressed diet, did all the things. His level wasn't going up significantly, so we started TRT, simple testosterone replacement. He was open to it, and after a few months, in fact 4 months, his hemoglobin normalized. It came up to 14, which is perfect, right in sort of that middle normal range. His overall desires and energy, libido, strength, and just vitality, it improved significantly. And his hematocrit didn't go up too high. It was still with a normal, like I said, his hemoglobin was 14, and his blood pressure on monitoring did not go up. This is always something you should keep in mind, just to be monitoring, of course. And so, great case for the significant. I mean, he told me basically this was a game changer, not just for how he felt, but his life, for his partner, for him feeling good about himself, being able to, get himself trimmed down, increase his muscle mass, like within 4 months, like he was a different man. Like it was crazy, crazy, crazy. So let's move on to women. What the heck should they be interested in this? Should they be? Should it be a part of their overall potential HRT regimen, hormone replacement therapy? I actually heard I was listening to an expert in the women sort of OBGYN genre. She's a physician OBGYN that was calling it PET therapy, progesterone, estrogen, and testosterone replacement therapy. And she's basically a woman doctor, right? She's an OBGYN, and she definitely does add testosterone to the regime with estrogen and progesterone, all bioidentical. Of course, we're talking bioidentical. We're not talking the synthetic crap that was used in the 2002 WHI initiative, right? Bioidentical. And she's had tremendous, not only safety, but efficacy, huge improvements using this with women at, of course, a much lower dose than men, because they don't need the same kind of levels as men, but they do need it. And so you got to measure the level, right? It all starts with checking your hormones, taking a look under the hood. And in women, it's a little bit more specific, especially if you're still menstruating. You want to check your hormones, especially the estrogen levels in the beginning part of the period, days 2 to 5, and the progesterone much later, like around day 20, 21, because this stuff matters. You got to, so if a doctor tells you it doesn't matter, it's just they're uninformed. It does matter, but you got to look. You got to check under the hood. And so right now in women, the indication for testosterone in women is basically to treat the sexual desire disorder. So low libido, low energy, low sexual desire, et cetera, et cetera. And that's the indication. Also, obviously, you're going to check a level, and you're going to do a much, much lower dose than in dudes. Because I've also seen the converse. Like there's people out there, they're like, well, if some is good, then more is better. And that's not the case, especially with women, right? They're going to start growing potentially a little bit of facial hair, having acne issues, things like that. You got to not only check the dose, but you got to monitor it with treatment. And of course, start with the lowest effective dose. But it can be, as in men, a game changer for their sexual function, their desire, their energy levels, all the things. I also love how it's been shown to increase both bone mineral density, which is super important because we don't want our ladies to be falling and breaking a hip or having osteoporosis, osteopenia. We don't want to have that. That's not good, right? And so this is a potential advance, improvement, help to be able to address this issue of osteopenia, osteoporosis, bone mineral density, and also to put on a little muscle mass. Like JJ Virgin loves to say, aging powerfully. And I don't know if you've met her, but I mean, she's got some guns. Like she legit walks the walk, not only talks the talk. So bottom line today, right now, evidence-based, it is indicated for the treatment of HSDD, hyposexual desire disorder, as well as it is helpful for increasing bone mineral density, muscle mass. And you should be using not, of course, just testosterone alone in women, but in the whole PET therapy gamut, as my colleague, the OBGYN, likes to say, progesterone, estrogen, and testosterone at appropriate bioidentical doses. And then you got to monitor it because it's so, so important. So here's a gal that I treated. She was 50 years old, had the indication, hyposexual desire disorder. And we started very, very low dose. I mean, it was like less than a tenth of the dose of what I would give a dude. And she opted to do transdermal, which is great. And we had to monitor it over time. And guess what? She felt better, more energized. Her desire went up. Her overall distress went down. She did not get acne. She did not get a hairy upper lip, which is called hirsutism. She did not get that. And we just monitored this every 3 months in the beginning and then every 6 months because you want to get the right dose for each person. That's bio optimized with this amazing life-changing treatment that is basically bioidentical to what your body would make already. And often as we age, just like all the other hormones tend to decrease, that's not ideal. You want to feel great each and every day. And it is safe, it is effective in men and in women, but you got to first check under the hood. So, in closing, let's just kind of end this fear, the fear mongering, the falsehoods of testosterone causing heart disease or estrogen causing breast cancer. Both of those things are categorically false. There is no good evidence to suggest that. In fact, I showed the best level of evidence today in the New England Journal that shares how testosterone replacement therapy is actually not only not inferior to placebo, but it actually caused less cardiovascular disease than the placebo did. This was not statistically significant, but it basically did not increase your chances of heart disease. Did not. It is safe, it is effective in men and women, and it can not only improve your overall functioning, especially sexually, your desire, all the things, your energy levels. It can also improve bone mineral density so you don't fall and break a hip or an ankle like I've seen too many times as my 20 plus year career in medicine. Sadly, seen the downside of folks with low hormone levels, whether it be testosterone, estrogen, progesterone, and having weak bones that they literally can break a bone stepping off a curb, like stupid stuff like that. And then it's life changing. It could put them in the hospital for weeks or even months. And 50% of the older folks who break a hip, they're dead within a year. Like that shouldn't be you. That shouldn't be happening. There is a better way. So number one, you got to look under the hood. You got to talk to your provider and you got to get checked. You got to get your levels checked. Realize that there is treatment available. It's bioidentical. It is possible to be able to feel better, to feel great, to not only add years to your life, but to add life to your years. And this is why I share this, because it is a message of hope that if you're feeling low, that you don't have the energy, you don't have the desire, you don't have the muscle mass that you want, you don't have the metabolism that you want, you got to get checked. Men and women alike, you got to get a look under the hood. You got to check your hormones. And if your provider won't do it, you might need to look for another provider. If you need help with this, you can message me, you can reach out to me, you can jump on over to my website, thomashemingway.com. I'm happy to help. You can message me on Instagram, Dr. Thomas Hemingway, or Thomas Hemingway MD on Facebook, because I'd love to help you. You just don't need to be living with this kind of additional stress and angst. And if you're a woman in menopause and you're having brain fog and you're having, just irritable mood and you're not sleeping well at night, you keep waking up and you're having hot flashes and all these things, there is a treatment, there is a better way, there is a possibility, and it's natural, it's normal, it's bioidentical for men and women. Hormone replacement therapy is not the devil, it's not evil, it's not dangerous, certainly not dangerous, does not cause breast cancer in women, does not cause prostate cancer in men, does not cause heart attack in either in men or women, and it can be helpful. It can be game-changing and life-changing. So get the word out, share this, make sure your friends, your family, your significant other, your mothers, your aunties, your friends, those that you care about, they get this information. Share it out and let me know. If you have any questions, reach out to me. Thank you for being here. A big aloha.